All right, guys, welcome to week three. Week three's lectures are going to include comfort, and we're going to talk about hygiene and safety. So right now we're going to talk about hygiene. So what is comfort? What do we think of when we think of comfort and hygiene? So comfort is just the individual's perception, the patient's perception of positive physical and emotional well-being. Comfort is also a biophysical concept that we cover in our CCBC nursing framework. Each patient has their own view of comfort. What might be comfortable to me might not be comfortable for you. So we always have to be open to understanding that everybody's idea of comfort is separate, so that way we can give the best nursing care possible. And then patient hygiene and grooming affects one's overall well-being. So where have we heard that before? So we know that Florence Nightingale was able to, through all her studying and nursing, was able to identify that there was a huge impact on a patient's health status with regard to their hygiene and their environment, okay? So now we know that your hygiene, your environment, and your grooming has a big effect on how a patient feels. So while well patients are able to care for their own hygiene and meet their grooming needs, ill patients still need a varying degree of assistance. Some need total assistance, some need just a little bit of setup and help, and some don't need any. So for most clients, personal hygiene includes bathing, right? So cleaning your entire body, oral care, brushing your teeth, using mouthwash, nail and foot care, so cleaning your cuticles, trimming your feet, your toenails, making sure you don't have any rough patches of skin. Perineal care is huge, making sure that that area is very, very clean and skin is intact so you don't get an infection. And then also hair care and shaving, so washing our hair, styling our hair, and keeping our faces shaved, especially for men. We do see this with women too, because as we get older and menopause kicks in, you do get unwanted hair, unfortunately. And there are also physical, psychosocial, and cultural factors that must be considered when providing care for or delegating the skills of hygiene, bathing, dressing, and grooming to your care techs. So according to Williams and Ayurveda, they did a study that showed therapeutic interactions providing physical comfort for hospitalized patients were associated with feelings of emotional comfort. The provision of hygiene or cleansing by a nurse is part of the historical giving of care or providing comfort. And we know this back from the days of Florence Nightingale, right? She was able to provide hygiene and keep her patients clean, and it left their patients knowing that they were well cared for and cared about, and it also had a positive impact on their healing and their environment. The more ill the patient, the more skill needed in providing the hygiene care, because the more sick they are, the less they can participate and the more that we as nurses have to do. So hygiene is an independent function of nursing. You do not need a physician's order to carry out any nursing activity. If you see your patient and you know that they need to be cleaned up, or they tell you that they want to be cleaned up, you can do it on your own without asking. Again, personal hygiene has a profound effect on the overall health, comfort, and well-being. That's very important. We keep on repeating this. You keep on hearing it because it's very important, and you need to remember it and integrate it into your practice. It's an integral component of an individualized nursing care plan. Student nurses must learn how to give bed baths to patients and how to bathe patients. And when you're a registered nurse, you may delegate this task to unlicensed assisted personnel, but the nurse is always responsible for making sure that it's done. And you must always evaluate the delegated work to make sure it was done properly. So remember, we spoke earlier about Florence Nightingale, and she said that she wrote notes on nursing. So she wrote that care should be taken in all of these operations of sponge washing and cleansing the skin, not to expose too great a surface at once. The amount of relief and comfort experienced by sick after the skin has been carefully washed and dried is one of the most commonest observations made at a sick bed. And lastly, every nurse ought to be careful to wash her hands, very frequently during the day. So these are things that we still implement now that she discovered many, many years ago. And these are huge interventions to patient safety, nurse safety, and increasing patient satisfaction and health outcomes. Okay, so here are some practices that influence a person's hygiene habits. So we have culture. So some cultures have unique hygiene practices. You have to always be sure to be respectful and observant of each patient's specific needs. For example, people from some cultures place a very high value on personal cleanliness, and they feel unclean unless they shower or bathe at least once a day. Many people consider bathing incomplete without the use of certain products to reduce or mask normal body odors, and other people often find that just a weekly bath is sufficient and may feel no need to mask normal body odors. Culture will influence whether bathing is a private or a communal act. So you always have to pay attention and be respectful and mindful of their cultures. So socioeconomic status, so example would be a homeless person. So a person's socioeconomic class and their financial resources always define the hygiene options available to that person. So a lack of funds to obtain toiletries or clean clothing may contribute to an inability to maintain good personal hygiene needs. For example, someone renting a room in a boarding house may have limited or no access to even a tub or a shower, and may have limited finances to buy soap, shampoo, shaving cream, and deodorant. Homeless people who often carry all their belongings with them in a car or a shopping cart or a book bag may welcome the warm running water and soap that is available in the roadside or found in public restrooms. Then we have spiritual practices that we have to be aware of. So spiritual practices, including religious beliefs, may dictate ceremonial washings and purifications, such as a prelude to prayer or eating. For example, in the Orthodox Jewish tradition, ritual baths are required for women after childbirth and menstruation. In some religions, contact with a deceased person or a deceased animal may make a person unclean. Other religions dictate that no modern facilities can be installed in homes. So this would prohibit some people from having running water and toilets in their home. And as a result, they may bathe infrequently. And then you have to consider developmental level. So children learn hygiene practices when they're growing up, right? Their family practices often dictate hygiene habits such as morning or evening baths, the frequency of shampooing, toothbrushing, and how often they change their clothes, how they feel about nudity and such. So as adolescents become more concerned about their personal appearance, they may adopt new hygiene measures such as taking showers more frequently, wearing deodorant. Bathing frequency commonly decreases as a person ages. That can be due to limitations in mobility. They can't get in and out of the tub. They can't get to the bathroom that has a full bath because maybe it's on the second floor. And then there's just a natural tendency towards drier skin when they get older. So older adults may experience an increase in skin conditions or problems, increasing the need for us to educate them related to hygiene and skincare. Then you have to think about the patient's health state. So any diseases they have, if they've had surgeries or injuries that can reduce their ability to perform hygiene, or motivation to follow usual hygiene habits. So if they're weak or if they're dizzy or they have a fear of falling, that can prevent them from entering a tub or a shower or from bending to wash their lower extremities. Illness may also create a demand for new or modified hygiene measures. For example, meticulous foot care becomes a priority for patients with peripheral vascular complications that often accompany diabetes. The presence of pain with an acute condition or chronic pain can affect a person's ability to perform and actually tolerate personal hygiene measures. And then we want to just keep in mind a patient's personal preferences. So we want to respect each patient's dignity. We want to reassure patients and allow them to have as much control as possible. I know we said earlier that in the hospital setting, patients lose a lot of control over what's going on. So we want to give them as much control over their environment as possible. People have different preferences with regards to hygiene practices. Some like to take a shower, some like to take a bath, some want to use bar soap versus liquid soap. Some people wash to wake oneself up in the morning. Some people get a shower just to relax before sleep. And then a person's self-concept and sexuality also influence their personal hygiene practices. I know that was a lot. All right, so when do we provide care? So we can provide care in the AM or the PM. We want to try to accommodate the patient's preferences. We want to provide care that always includes bathing, oral hygiene, hair care, bed making, back massage, fresh water, offering patient to go to the bathroom or use a bedpan or a urinal, and we always want to keep their room straight. So they always, when they come in the hospital, they're usually in a room by themselves, depending on what type of a unit you're on. That's ideal that they have a room by themselves. It's even better, but it's usually a small room. So that their environment is very small and very limited. So you want to keep it tidy. You want to make it as appealing as possible. It's not usually too appealing because it's so small. So anything that you can do that has a positive impact on their environment is going to be helpful to the patient's recovery and their outcome. So we know that the benefits of personal care, it provides comfort. It helps promote relaxation. It promotes circulation, gets the blood flowing. It demonstrates caring. It shows them that we care about them and we care about their comfort and their healing, and we want to do whatever we can to keep them comfortable. And it also provides a time for the nurse to assess, to communicate, and teach. So when you're given that bed bath and you're cleaning their upper extremities and their lower extremities and their perineal area and their back, you're looking at that skin. Do they have skin breakdown? Do they have rashes? What's going on with their skin? Do they have any open sores? It's a perfect time to give a bath so that you really get a good look at their skin. It gives a time for you to communicate with them. You're looking at their skin, you're giving them a bath, you're talking to them, you're figuring out their mental status. Are they alert and oriented? Do they know what's going on? It's an opportunity, if you see something going on with their skin, to teach them about how to implement certain skin things at home that they can do to prevent dry skin and things like that, depending on whatever they have going on. So it's a great opportunity for a nurse to give a bed bath. So assessment. So you want to assess their self-care ability. You want to determine, do they have any physical or cognitive impairments that keep them from implementing hygiene measures, okay? So if they did have any self-care deficits, that nursing diagnosis would be bathing self-care deficit. It's always important to evaluate their ability to be able to participate in personal hygiene. I am a big fan of this. I always want to encourage clients to participate in any way that they can. So maybe some patients just have maybe they just need to help being set up at the side of the bed. So maybe they can sit up at the side of the bed, but they really can't ambulate. So you'll go to the sink and you'll get their little basin and you'll fill it with warm water. You'll give them wash rags. You'll put the cleaning stuff inside the container for them. You'll give them the towels and you'll set them up. Maybe you have a patient who can't move their lower extremities and can't even sit at the end of the bed, but maybe you can give them a warm washcloth so they can at least clean their hands or they can clean their face, whatever area they can reach. I always want to encourage independence, okay, as much as possible. It may be limited, but some is better than nothing. So then you want to integrate assessment, okay, when you're given that bed bath, you're assessing that skin, you're assessing their range of motion, how far can they move their legs, how far can they move their arms, and then it's a good opportunity to do dressing changes if they have skin breakdown or they've had a surgical incision. While you're doing that hygiene, you change all those dressings. You want to assess their hygiene practices and make note of their preferences and make sure you're incorporating that into their hygiene. You want to assess the patient while performing personal care. We keep coming back to that. Some areas to start to assess would be including your skin, looking for that skin breakdown. Is it pink? Is it red? Is it pale? Are there any skin issues? Is there any skin breakdown? Any open sores? You want to look at the oral mucosa. So when you're doing that mouth care, you want to look in the mouth. Do you see any ulcers, any skin breakdown? Are their gums infected or inflamed? While you're doing that, the bed bath, you're talking to the patient. Are they alert and oriented? Do they know where they're at? Or do they know that they're in the hospital? Do they know what day it is? Do they know what's going on? Do they know what brought them in? Also, while you're assessing them and you're moving them around, you're going to be able to know if they have any pain. They're going to let you know. And then you're going to be be able to determine what their mobility status is. How much can they do? Do you think you can get this patient out of bed? Do you think that they can sit at the end of the bed? It gives you a lot of insight on what the patient's capable of. And then you're also going to assess whether the patient is able to tolerate a complete bed bath. So turning a patient from one side to another to expose the back or to expose the front increases oxygen demand, and they can fatigue very easily. So I was actually, a good example of this is I was taking care of a COVID-19 patient the other day in the SICU, and he was, he wanted me to scratch his back and put some lotion on his back, and I had to have him roll over, and he was a very big man. He weighed about 250 pounds. I was the only one in the room at the time, and I just needed him to roll over onto his left side. Well, when he was just laying on his back, his oxygen level was about 98 degrees on 40 liters. So he had a high rate of oxygen because he was a COVID patient. But anyway, when I finally got him to move over to his left-hand side, his oxygen dropped to 68. It took everything in that patient's, body to just turn over. It was so hard for him, and it took so much oxygen. And he just said, I can't do it. He's like, I just can't even roll over. I'm that sick. So you really have to think about whether your patient can withstand turning so that you can give them a bed bath. So some nursing diagnosis that we might see. So we have bathing self-care deficit, which could be related to postoperative weakness or just if they're sick. You have impaired oral mucosa membrane, which could be related to dehydration, altered nutrition. Some chemotherapy patients have sores in their mouth, so that could cause that. You have dressing, self-care related to pain and weakness. And then you have impaired social interaction, which could be related to negative body image. And an example of that would be maybe if the patient had acne. So what kind of baths can we give? So the purpose of bathing, again, we're back to that again, increases your health outcomes, increases social interaction, promotes comfort and relaxation. You bathe clients to cleanse the body, stimulate circulation, provide relaxation, enhance healing. You can give a complete bed bath. Let's back up. There's a bed bath, which is just for patients who have to remain in bed. So maybe they normally are not bed bound, but maybe they are not allowed out of bed because they're on, they can't move right now because they've had a surgery and they have to stay flat for a certain number of hours. Well, just because they have to stay flat, it doesn't mean that they can't be clean. You can't clean them. So you would want to you would want to give them a bed bath for those patients that can't move. There's a complete bed bath for totally dependent patients. Okay, there's partial assist bath, which involves bathing only the body parts that would cause discomfort or odor if left not bathed. And then there's the assist bath. So that includes assisting patients to wash those body parts that they cannot reach. Then we can put patients in the shower, right? They can sit or stand under a continuous stream of water. It's good for patients who have difficulty getting in and out of the tub. You can do a tub bath. We don't have tubs in the hospital, but this involves immersion in a tub of water. I think we all know what a tub bath is. There's a disposable bath, which are moistened cloths that require no rinsing, and they're disposable. They come in little packs. You usually put them in the microwave and heat them up, or some facilities have like a little warmer that they stay in, so they're nice and warm when you take them out. And then there's a therapeutic bath, which is a prescription which includes specific type of bath and solution like oatmeal. So for patients who have chicken pox and things like that, shingles, it causes itching, you might want to use that type of a bath. So then you have your disposable bath. We just talked about those. They're usually prepackaged in single use units. They're heated before, and they don't require any rinsing. There's usually 8 to 10 pre-moistened washcloths per package. The package is usually unopened, and you put it in the microwave to heat it up. Each part of the body is cleaned with a fresh cloth, okay? You don't clean your under armpits and then clean your eye. You want to use a separate one for each body part. And these products help to eliminate cross-infection, risk posed by soap, water, and body basins and washcloths because they hold a lot of bacteria and can cause infections. All right, so this is just an example of a bathtub where you could put a patient in. And then these are pictures of the bathing cloths that we were just talking about. So bathing, so we want to make sure that we collect all the supplies that we need. We always want to provide privacy for our patients, shut that door, pull that, that curtain around, and then we always want to explain to the patient what we're going to do. We just don't go in, rip the covers off, and start putting, you know, washcloths all over them. You always want to explain what's happening. You're going to use gloves, these standard precautions, because you might come in contact with bodily fluids. You're going to place a bath blanket over the client, and then you're going to remove the client's gown. You don't want to just remove their gown and keep, you know, all their goodies exposed for everyone to see. And then it also can cause the client to be cold. So you want to be mindful and respectful and make sure that you cover them up. We don't really have anything in the hospital called a bath blanket. You can use a towel, or you can also use just like a regular blanket that we have in the hospital. So when you do a complete bed bath, you're going to wash the face first. You're not going to use soap because if it gets in the eyes, it can cause burning. You're going to move down to the neck. Then you're going to move down to the chest. You'll work down to both arms and then to the hands. Then you'll go to the abdomens. You'll clean the hips, the thighs, the legs, and then the feet. Then you're going to roll the patient over. You're going to clean their back. You're going to start with their upper back. You're going to work your way down. You're going to clean the buttocks and the perineum last. The temperature of the water should be comfortable. You don't want it too hot, but you don't want it too cold. You're going to lower the temperature with children and adults over 65 years of age, and then you're always going to change the water whenever it's soiled or cold, because you just put yourself in their position. How would you like it if someone used a rag on your bottom, okay, to clean that area and then put it back in and then started cleaning your legs? You wouldn't like that, and you certainly wouldn't like it if the water was cold. So we have to be very mindful. So now we're going to talk about oral hygiene. We're going to talk about the benefits of oral hygiene. We're going to talk about dentures, and then we're going to talk about unconscious mouth care. So we know that the benefits of oral hygiene can be that it prevents diseases and dental caries, which are cavities. It also provides comfort, okay? It stimulates your appetite. You clean their mouth and they have a fresh, you know, fresh mouth. It helps them stimulate their appetite and then their food tastes better. It can reduce halitosis, and halitosis is just a fancy name, another nurse word for bad breath. It reduces stomatitis. Stomatitis is an inflammation of the oral mucosa. It has numerous causes. It can be caused by bacteria, viruses, mechanical trauma, certain irritants, nutritional deficiencies, and some certain types of systemic infections. So symptoms can include warmth, pain, increased flow of saliva, and then halitosis, which is that bad breath. It decreases gingivitis, which is an inflammation of the gingiva, the tissue that surrounds the teeth, and it promotes digestion through stimulation of saliva, which contains digestive enzymes. So whenever you're brushing your teeth, it increases that saliva, okay? So it promotes digestion through the stimulation of saliva, which contains digestive enzymes. It limits the growth of pathogens in the oropharyngeal secretions, which decreases the incidence of pneumonia. And CHG is available in an oral spray and a dental gel, which reduces the incidence of healthcare and associated pneumonia. So CHG is a chlorhexidine. We usually give it as a bath, and it helps reduce the risk of infection. You see that in ICUs and surgical care units. They do CHG baths. And with cancer patients, we do it around their central lines. So when we provide oral care, we're going to check for aspiration risk. We're going to make sure that our patients are able to swallow, and we're going to check to make sure that they don't have a decreased gag reflex, because you give them that toothpaste and then that liquid, they might swallow it. It could choke, it could go into their lungs, they can get aspiration pneumonia. So you want to make sure they're not at risk for aspiration. And then you want to be careful with clients who have fragile oral mucosa. So thinking of the patient that has chemotherapy and their mucosa is inflamed and they have those ulcers, you know, you still want to provide mouth care, but you want to be very gentle. Encourage them, if they're doing it themselves, to be gentle when they're brushing, and then gentle when they are flossing. So with regard to dentures, So dentures are very fragile. They can break easy and they cost a lot of money. So you always want to be very, very careful when you're handling patients' dentures. You want to be careful with them. You always want to clean them under warm water. After they're clean, you want to rinse them with cool water. You want to dry them very good. You don't ever want to force them to become loose, okay? You want to have the patient to remove them if they're able to. When you're brushing them, you want to brush them in a horizontal back and forth motion with a very soft brush and some type of denture cleaner. You want to store them in a labeled container. So if your patient comes in and they have dentures and they don't have a container, you usually have certain containers on the floor for dentures. You want to get one, put a patient label on it, make sure it has their information on. It's very, very, I can't tell you how many times I've seen patients lose their dentures. They take them out, they put them on their bedside, their table where they're eating, their trays, and then somebody comes and grabs the tray from, dietary, and they get thrown away and they're gone forever. And they're really expensive. They're a couple $1,000s. So you want to educate that patient. If you can't be in the room before their food comes to grab the dentures and put them, you want to try and make sure that you educate them about removing them. And then you always want to place the dentures in a denture cup with water to keep them moist when they're not in the patient's mouth. So then providing unconscious mouth care. So providing mouth care is always important in the conscious patient and especially in the unconscious patient. It should be done, in my opinion, at least every 4 hours, depending on the condition of their mouth. So you want to always make sure that you have suction apparatus ready at the bedside because these patients are unconscious, which means when you put liquid in or any kind of mouth cleaning liquid, they can just swallow that right away because they're not conscious. It's going to go right down their throat. So you're in there brushing, you're adding a little bit of water and you're sucking it out as soon as you're putting it in there. You want to use extremely small amounts of liquid so that you're able to get it out with that suction catheter. You want to always position the client on their side with their head turned towards you. If they're on their back, what do you think is going to happen when you put that water in? It's going to go right down their throat. They could aspirate. They could get aspiration pneumonia, okay? You want to do a very good inspection of their oral cavity. Is it red? Is there any areas that are swollen? Do they have any blisters? Do they have any ulcers? Anything like that? And then you want to make sure that you're really cleaning all areas of the mouth, including their teeth, their tongue, their gums, and then the roof of the mouth. And then you want to make sure that their lips stay dry, nice and moist, that they don't get dry. So you want to put moisturizer or Vaseline on their lips. So here is a question that we will go over that you guys will respond to when we have our live lecture, and that is, which gum disease manifests as a marked inflammation of the gums that also involves degeneration of the dental tissues and bone? So if you're doing your weekly readings, you will know the answer to that question. So now let's talk about eye care. So when you're doing eye care, you want to use water or normal saline and a clean washcloth or some type of a clean compress to clean the eyes. Never use soap to clean the eyes because soap is irritating, it'll damage the eye tissues, and it'll cause burning. So you dampen a cleaning cloth with the solution of choice, and then you wipe once while moving from the inner canthus to the outer canthus of the eye. You can look in your book, there is a chart that will show you exactly how to perform eye care. When you're washing the external ear, you want to use a washcloth and you want it to cover your fingertip. You don't want to use a cotton tip swab. You don't want to go into the ear. It can cause ear damage. When you're performing hearing aid teaching and care, if needed, you want to take extra care of their hearing aids. You want to make sure that their ears are clear before you put them in. You want to make sure that the batteries are good. Most patients can put them in themselves. Some can't, so you might have to assist them. You want to help the patients clean their nose by having the patient blow if both nares are not patent, if they're not breathing well. And then you can remove crusted secretions around the nose by just applying warm, moist compresses to that area. Always warm compresses helps remove crusties and things like that. So then when we're dressing and undressing patients, we want to dress the affected side first. So if they've had a stroke or a surgical procedure that's has one side of their body affected, that's the side we're going to dress first. And then we're going to undress the affected side last. Okay. Perineal care. It is important to maintain skin integrity to relieve discomfort and to prevent the transmission of infection, especially during catheter care. So you always want to perform care in a very professional manner. This is a very personal experience between a nurse and a patient. Some patients, older or younger, can become embarrassed by this. They can be upset for the fact that they can't perform this care themselves. They might be embarrassed. It might be a cultural thing because they're showing body parts to a woman. You know, it might be against their cultural preference. It can be embarrassing. It's just a very personal activity. So you always just want to be professional and provide privacy. Again, you may come in contact with bodily fluids, so you're going to implement those standard precautions and always wear gloves. You can just use plain soap and water. You don't want to use anything that's going to be irritant. And then you're going to be mindful of personal, cultural, or religious beliefs that may cause the patient to want to have a same-sex caregiver. And it's not uncommon. I hear this a lot in older women patients. They don't feel comfortable with male patients taking care of them. And that is something to consider. So you would want to make sure that you would have somebody else on the floor that would help provide their care if that is their case. So for perineal care for men, we are going to want to keep a few things in mind. We are going to want, with the male, we are going to want to make sure that we retract that foreskin on the male penis, right? We want to clean the tip of the penis very well. We want to clean from the meatus outwards in a circular motion. Then we're going to let that foreskin come back. We're going to gently cleanse the scrotum. These are sensitive areas for men, so you want to be gentle when you're doing that. And then you always want to make sure that these areas are dried very thoroughly. For females, we're going to make sure that they are placed in a dorsal recumbent position. The slide after this will show you what that position looks like. You're always going to wash the patient from front to back. You never want to wash back to front because any kind of stool or feces that is in the back can come up into the vagina and into the urethra and cause an infection. Urinary tract infection or any kind of infection. So you aggressively cleanse the perineal area with a washcloth or towel. You're going to wash the labia majora. You're going to use a separate area of the washcloth for each side, and then you're going to separate the labia and cleanse thoroughly around the labia minora, the clitoris, and then the vaginal orifice, and then make sure that you are drying very thoroughly. So this is that dorsal recumbent position that I told you about. This is what the female would look like, okay? So urinals at the top, this is a urinal that a male would use. At the bottom, this is a urinal that a female would use. I've only ever seen this once in our facility. We got it once and then we never purchased it again. It was probably too much money. That's usually how things work in a hospital setting. The dollar dictates everything. So this is contact with bodily fluids, implementing those standard precautions, wear gloves, and you want to place the urinal correctly. You want to allow the patient to stand if they're allowed and able. So this is beneficial to male and females, but more so with males, it is very, very difficult for them to pee laying down or sitting at the end of the bed. So it's not always ideal. You can't always get them up. Maybe they had surgery on their leg and they're non-weight bearing, so they can't stand up, and you have to do with the best with what you have, but it does, things do start to flow better once they stand up. So sometimes you have a patient after surgery that's retaining fluid, they're not peeing like they should. Something such as so simple as just getting them up, getting them to the toilet, walking them, sitting them on the toilet will help them pee. So always standing them up is helpful if you can. If you can't, you always have the bedpan. There's two kinds here. Again, we're going to wear gloves and you're going to make sure you place the bedpan correctly. You're going to remove it carefully and make sure that the perineum is cleaned, very good, and dry. So the bottom left picture is the bedpan that I use on smaller patients or patients that have skin breakdown or they're very bony and they have prominent areas, because it's a little bit more comfortable. Larger patients can tolerate this bedpan that you see, the blue one to the upper right on your screen. And the area that is open, the smaller area is the part that goes towards the back. You would never want to put this huge area towards their back and this towards their vagina. So exactly how you see it is how you would put it under the patient. And then this little area here would go to the back of the patient, and this would be in the front. So performing catheter care is very, very important. You're always going to want to clean with warm water and mild soap. You're going to use an antiseptic according to your facility's policy if they have one, and you're always going to clean the tubing starting at the meatus closest to the vagina or the urethra, and you're going to go away from the body. So each policy is different for each facility. So my facility says that we have to clean the catheter once a shift, once between 7 a.m. and 12 p.m., and then once again at night between 7 p.m. and 12 a.m. We have to document that it's done. And if we don't, if a patient gets a UTI, then they're going to go back and look at that documentation and say, oh, it wasn't clean. And this is one of them events where Medicare and Medicaid don't pay if the patient gets a catheter-associated urinary tract infection, okay? So we always want to make sure that we're keeping that catheter clean. Very, very, very important. So part of nursing and comfort is providing a back massage, okay? It's very nice to do this for your patient. If you have time, you can do it for about 3 to 5 minutes. You can use warm lotion when you're doing it. You can use various strokes and alternating firm and light pressure depending on what your patient likes. You would report any reddened area, bruises, or skin breakdown to the doctor. This is a good opportunity for you again to assess that patient's skin, see what's going on. Are there any areas of skin breakdown? Do they have any open areas which can get infected? It helps to promote relaxation. It helps to relieve muscular tension, and it stimulates skin circulation. So for hair care, we can brush and comb our patient's hair, which helps stimulate scalp circulation. While we're doing that, we're going to want to assess hair and scalp for problems. Do they have dandruff? Do they have hair loss? Do they have baldness? Do they have lice? Any kind of redness or injuries to their head? Any open areas? We want to make sure that we keep their brush and their comb clean after we use it and keep it at the bedside. You can always use the patient's own brush and comb if they have it. If not, there's usually one on the floor that you can give them. They can take it home with them. You want to make sure you're providing care daily, and then you want to treat any infestations. So if they have pediculosis or ticks. So other options for hair care, if they can't wash their hair, they have this great shower cap right here that you put on their heads, and you don't have to rinse it. It just cleans the hair and it dries. This is some no rinse shampoo. I've never really seen that in the hospital, but I do see the shower caps all the time. So they make disposable caps which contain a rinseless shampoo product. You always warm the cap in the microwave, so make sure it's comfortable for the patient, not too hot. You place it on the patient's head, and then you massage the hair and the scalp through the cap to lather the shampoo up. After the manufacturer's suggested length of time, you remove the cap and you discharge the cap, you throw it away, and you use a towel just to dry the patient's hair. A bed shampoo, I've never seen these in the facility. It's like this little blow up thing that you put behind the head. You want to keep the patient as dry as possible. You want to put like a little towel around their neck. You want to make sure the temperature of the water is warm to touch, but not too hot that it's going to burn the patient, or too cold that it would be uncomfortable. You want to make sure that you're rinsing their hair very thoroughly. And this is relaxation and also can promote comfort for the patient. So here's another question that we're going to answer when we do our live lecture, and you will know the answer if you do your readings. Tell whether the following statement is true or false. Pediculitis, which is lice, can be spread directly by contact with the infested areas or indirectly through contact with clothing, bed, linen, brushes, or combs. So next we're going to talk about shaving. So shaving is very important for men. It helps improve self-esteem and gives them a sense of well-being. You want to wear gloves when using a disposable razor because you can come in contact with blood, right? You want to shave the way that the hair grows. If not, you can get what they call razor burn, which is little red dots all over the face, or it can actually bleed. You never want to use an electric razor when oxygen is in use. It can become flammable. And you always want to think before you do shaving with a patient that has any kind of bleeding disorder, because if they have a bleeding disorder, they are at risk for bleeding. So you wouldn't want to use just a disposable razor, because that increases their risk of bleeding. Instead, you would want to use that electric razor. So if you wanted to see the guidelines for nursing care for shaving, you can go to page 1010 in your Taylor book and see table 31-5, and you can get some more information. So now we're going to talk about nail care. So when you're taking care of your patient's nails, you want to look and you want to note the size of the nails, the shape, and the condition of their nails and their nail bed. So you're going to check to see if they have any cracking. Do they have any clubbing? Clubbing comes from a lack of a decreased amount of oxygen over a long period of time. So you see this a lot in patients that have COPD. You want to look and see if they have any fungus. And then you're also checking that capillary refill to make sure that they have good blood flow. You want to check your facility's policy before cutting nails. At my facility, we don't even carry toenail cutters or fingernail cutters on the floor. We're not allowed to cut any patient's nails. If you work in a nursing home and maybe you are going to have the ability to cut or trim the nails, you're going to make sure you soak them before trimming or cleaning them, except for diabetic patients. That's definitely contraindicated. You would want to gently clean under each nail. Push back those cuticles very gently. You can apply moisturizer to the hands and the feet, but you want to avoid applying it between the fingers and the toes, because those areas get very moist, and then you can get fungus or some infection in that area. So that you would want to avoid. When we're doing foot care, proper foot care is extremely important at any age, and even more so important with aging and when you have such conditions such as circulatory disturbances or diabetes mellitus. So assessment leads to early detection, and you want to encourage patients with this disease to see a podiatrist for treatment related to bunions, corns, calluses, or overgrown or discolored toenails. You want to encourage them to wear well-fitting closed-toed shoes. You want them to break in new shoes gradually over time, and you want to educate them that improperly fitting shoes can lead to corns, calluses, bunions, and blisters. The soles of their shoes should be very flexible and non-slippery, and the heel heights should be safe and offer the appropriate support. Shoes with rough ridges, wrinkles, or tears in the linings should be discarded or repaired. You want to encourage people not to walk around in bare feet or use heating pads. Walking around in bare feet or showering in bare feet can cause athletes' feet. That example would be, if you're using the same shower, like in long-term care facilities and stuff like that, or even if you come in the hospital, it's a good idea that they wear sandals or something like that. And then you want to avoid the heating pads on the feet, because that can cause blistering, especially in your patients that have diabetes mellitus. They tend to have neuropathy, which is a decreased sensation in their feet. They have numbness, tingling. So if they're having that hot pack on their feet, they won't know if they're burning their feet, okay, because they don't have any sensation or a decreased sensation. You want to make sure that they are performing foot care daily, washing the feet and drying thoroughly, especially in between those toes. You want to inspect the feet, right? Diabetic foot care, make sure that they don't have any open wounds on the bottom of their feet. I took care of a patient one time who came in with a huge hole. I'm talking, it was about 4 inches. It was about 4 inches by 3 inches. It was a circle, and it was down to the bone. And he had no idea that he had this sore here, because he had stepped on something in the house. It got infected and it manifested into this huge sore, but he didn't feel it because he had diabetes. So he had neuropathy and he had that decreased sensation. So you want them to always inspect their feet. You want to discourage patients with diabetes and peripheral vascular disease from doing nail care at home. They should go to a podiatrist. And then there are more guidelines for nursing care on page 1011, table 31-6, if you wanted to see more. So eyeglasses, you want to make sure that you keep your patient's eyeglasses clean at all times. If you're taking care of your patient, you're doing an assessment and they have their glasses on and you see that they're dirty, please take an extra minute to clean them. Some people are just too sick that they don't have the effort to clean them. Some, their vision's impaired and they don't know that it's dirty, but You know, it's an act of caring. What would you want for your mother or your father or for you if you were their age and your glasses were dirty? You would want someone to just notice it, take a minute out of their day and clean their glasses. I do this all the time and patients are so appreciative. You want to report broken glasses or patient complaints about their glasses. They might have came in with broken glasses, and if you don't notice it or write it down, they could say that it happened at the facility and the facility could be responsible for replacing them. You always want to make sure, just like the hearing aids and the dentures, that you store them in a labeled container and make sure that they don't put it on their food tray, because like I said, they put it down there, dietary comes by, they're in a big hurry, they don't realize it, and then they're gone. And these are expensive things: eyeglasses, hearing aids, and dentures. And then you want to handle them very carefully, only by touching by the sides of the frames. So next is hearing aids. We want to make sure that we keep these hearing aids safe. They cost a lot of money. We don't want to expose them to heat or moisture. We don't want to put any lotion on them, any sprays or any shampoos. We want to make sure that that ear is extremely dry and clean before we put them in. We want to handle them very carefully. They are fragile. They're very tiny. There's not much to them. We want to make sure that the batteries are working before we put them in. We want to allow the patient to insert them and remove them if possible. Again, keeping the patient involved in their care gives them a sense of independence. You always want to encourage them to do as much as they can do. And like the dentures and the eyeglasses, you want to make sure that they are stored in a labeled container and not put on that tray, because we don't want to have to replace them. And a lot of people that have these issues, they are elderly adults and they're on limited incomes anyway. So you always want to be mindful. They're probably not going to have another $3,000 or $4,000 to buy more hearing aids or dentures. So we just really need to be mindful of that. So now we're going to talk about the type of beds that we see in the facility. So there are closed beds, open beds, occupied beds, unoccupied beds, and then surgical beds. So this right here is an occupied bed, an unoccupied bed, and it's a hospital bed, okay? Bed making terms that you want to know. So you're going to want to have, when you're changing beds or making a bed, you're going to want to have a linen bag. You're going to take your linen bag in with you, and you're going to take all the dirty sheets off and put them in that linen bag. You never want to throw them on the floor. That increases the risk of spreading infection. So you always want to have that linen bag. You're going to have a top sheet and a fitted sheet. So you're going to put that fitted sheet over top of the mattress, and then you're going to have a top sheet, which the patient covers up with. You want to have a draw or a lift sheet. Those terms are used interchangeably. Usually you use we don't have specific draw or lift sheets in the hospital. What we use is a top sheet, and we fold it accordingly so that it fits in the middle of the bed and the patient lays on top of that, and that sheet is what we use to pull the patient up in bed if they slide down in bed and we need to reposition them. You want to have a waterproof pad that goes over top of that lift sheet so that if they do have an accident or if they're incontinent, it gets caught on that pad and it decreases the amount of times you have to change the linens because you have that waterproof pad there. You want to have over top of that top sheet a nice blanket or a spread that the hospitals have to help keep them warm. And then you want to have a mitered corner or a hospital corner. You guys are going to learn all about this in the lab. And then a toe plate. And you can look in your book to see examples of these. So what does proper bed making provide? So there's nothing, for me, I just love it when I wash my sheets, which I change weekly because I can't, I'm just neurotic, but I love it when I change my sheets on a Saturday, and Saturday night I go to get in my bed and they're fresh and they smell good and they're, there's no wrinkles or anything in them. It is just the most comforting feeling. And when patients are not in their environment, we want them to feel as comfortable as they can in the hospital. So we always want to make sure they have clean linens. It provides comfort for them. It prevents skin breakdown. If we're cleaning their linens, they're not sitting in urine or feces or crumbs. The sheets are pulled tautly, so there's not any wrinkles. They're not going to get skin breakdown, which will lead to infections and open sores. And it also serves the prevention of fatigue and injury to personnel and patients. So keeping the patient safe, keeping up the side rails, keeping them from falling, the ability to raise the bed up for nurses and techs to protect your back, That's what proper bed making can serve for the patient and the nurse. All right, so we have patients at risk for developing hygiene problems. So patients that are unable to use their upper extremities, if they have impaired physical mobility, if they've had a surgery, if they've had a stroke and they have permanent disability, if patients don't have proper use of their upper extremities, they are not going to be able to provide hygiene for themselves. So you need to be able to recognize which patients are at risk for being able to provide care for themselves, okay? Then you have patients who are on chemotherapy or radiation therapy. They're at risk for not being able to provide proper hygiene. They might have neuropathy in their hands and their feet, okay? So they might not be able to ambulate properly. They might not be able to use their hands properly. Immunosuppressive therapy, then you have decreased sensation. So these chemotherapy patients or these diabetic patients that have this neuropathy causes an decrease in the sensation that they feel, which inhibits their ability to perform hygiene on themselves. If you have decreased visual acuity, if you don't see well, you're not going to be able to see what you're doing. You're not going to be able to see to get to the bathroom. You're not going to be able to see where your cleaning supplies are, your washcloths are. It's going to be difficult. And then if you have decreased dexterity, you're not going to have the dexterity that you need to be able to use those fine motor skills or those gross motor skills to wash your hands, to wash your feet, to, clean all the areas that need to be cleaned. So then we're going to talk about bed position. So if your patient is in bed and their bed is at a 45-degree angle, that is what we call the Fowler's position. If they are at a 30-degree angle, that's what we call semi-Fowler's. And then we have Trendelenburg position, which is what we use when we want to put gravity on our side to help pull up large patients that need, help. You can put them in that position and puts gravity on your side, and it makes it easier on your body. And then you have a reverse Trendelenburg, and then you have a flat, which is a supine or a prone. So this is your Fowler's position here. This is your Trendelenburg. So if you want to move up a large patient, you put the bed in this position, and this pushes gravity on your side. So you just have to grab that lift sheet and pull the patient up, and it's a lot easier. This here is your reverse Trendelenburg, pretty common, right? This is your Trendelenburg. This is the opposite. Trendelenburg. Then you have your supine or your prone. Okay, so supine is laying on your back, prone is laying on your stomach with your head tilted. A lot of you guys are hearing about this proning that we're doing with these COVID-19 patients. We're periodically putting them in these positions because when you do, it takes all the pressure off of the lungs and improves your gas exchange through your lungs. And last but not least, this cute little puppy in the bathtub, happy bathing. All right, so this is all for comfort and hygiene. The next recording that we do for week 3 is going to be safety. And if you have any questions, we will go over it again on our weekly live Zoom session.